Dear students, welcome to another Medetuit lecture. The topic for today's session is permanent maxillary canine. Take a look at these videos. Did you notice any similarities? Here, we can see that the long exposed canines give these animals a terrifying appearance. Another example of visualizing sharp canines would be the case of vampires shown in films and cartoons. Canines have been used as a symbol of rage and terror since time immemorial. This might be because of the fact that teeth are the hardest structure in animals and canines are the strongest and longest of them. Well, let's move the psychological perspective of the human canine aside and take a closer look at its morphological features. Today, we will be discussing its introduction and chronology, labial aspect, palatal aspect, mesial aspect, distal aspect, occlusal aspect, and clinical considerations. So, let us begin with the introduction and chronology. The four canines are placed at the corners of the mouth, that is, each one is the third tooth from the median line, right and left in the maxilla and mandible. The canines are referred to as cornerstone of the dental arch. Canine eminence is a bony ridge over the labial surface of the roots that help form a foundation that ensures normal facial expression at the corners of the mouth. It is cosmetically important. The canines are thus aesthetically and functionally very important. These teeth are also called cuspids. Canines have greater labiolingual measurement than mesiodistal. Maxillary canines are two in number, located distal to maxillary lateral incisors and mesial to maxillary first premolars. Chronology. The first evidence of calcification happens at 4 to 5 months of infancy. Enamel completion occurs around 6 to 7 years of age. Eruption into the oral cavity is seen at 11 to 12 years, and the root completion is by 13 to 15 years. Now, let's take a closer look at the detailed description of different aspects. The first aspect is the labial aspect. From the labial aspect, the crown is roughly pentagonal in shape. The mesial outline may be convex or slightly concave from the cervix to the contact area, located at the junction of the middle and the incisal third. The distal outline is concave from the cervix to the contact area. The cervical outline is curved in an apical direction. The incisal edge is represented by the cusp and cusp slopes. The distal slope of the cusp is longer than the mesial cusp slope. The labial surface is convex. Maxillary canines have the longest root. The root is slender and conical with a bluntly pointed apex that bends distally. Next is a palatal aspect. The palatal aspect of the canines also shows convexities and concavities. The cingulum is seen as a convexity at the cervical third and is very prominent, resembling a cusp. The cingulum shows greater development than that of the central incisor. In the mesiodistal direction, the cingulum is centered over the tooth. Both the mesial and distal marginal ridges are prominent. The lingual aspect of canines shows a concavity called the lingual fossa. The root is narrower lingually, and much of mesial and distal surfaces are seen from this aspect. The third aspect is the mesial aspect. The crown is wedge-shaped with the base at the cervical third and apex at cusp tip. The labial outline is convex with the crest of convexity at cervical third. The lingual outline is convex in the cervical third at the cingulum where the crest of curvature is located. The mesial surface is convex in all aspects except for a shallow concavity between the contact area and cervix. The root is conical with an apical taper. The mesial surface of the root has a deep developmental depression running cervico-apically. The fourth aspect is the distal aspect. General morphology here is similar to that of the mesial aspect. Differences observed are the curvature of the cervical line is less, the distal marginal ridge is heavier and regular, developmental depression on the distal surface of the root is more pronounced than on the mesial side. And finally, let us discuss the incisal aspect. From the incisal aspect, a greater labiolingual measurement than mesiodistal can be well appreciated. The crown is not symmetrical. The mesial half of the tooth appears more convex and bulkier labiolingually than the distal half. The cusp tip is located labial to the midline in a labiolingual direction and mesial in a mesiodistal direction. Labially, the labial ridge can be seen. Lingual outline forms a shorter arc than labial outline because of the lingual taper. That concludes the 5 aspects of the tooth. Now, let us look at some clinical considerations. Talon's cusp. Sometimes, the cingulum might become so prominent that it resembles an eagle's talon. It might interfere with the occlusion. Let's summarize today's topic. The canines are commonly referred to as the cornerstone of dental arches. Their importance is manifested by their efficiency in function, stability, and aid in maintaining natural facial expression. We have discussed in detail the various aspects and the features associated with them. Before we conclude today's session, let's have a quick Q&A session. Name the bony ridge or the maxillary bone above the canine tooth. Canine eminence. The approximate age of eruption of the maxillary canines into the oral cavity is 11 to 12 years. From the labial aspect, which proximal cusp slope is longer? Distal cusp slope. I hope you understood this session well. I'll see you all in another Medetuit module. Thank you.